Hi, this is Dr. Vladan Stojanovic, your everyday dentist, and today we are talking about the first visit to a dentist. So the first thing you need to do is find a dentist. My own recommendation is just to use your own dentist. You're already comfortable with him. You can just call him up and ask him if it's okay to schedule an appointment for your kid. Explain to him that there is nothing wrong and you just want him to get used to the office, play with him a bit, etc. If that is not an option, then you should just try to find a pediatric dentist online, or even better, ask your friends and family for a recommendation of the dentist they take their kids to. If you are wondering when is the perfect time to take your kid to the dentist, I made a video specifically talking about that. However, according to a recommendation by American Dental Association, it's by the age of 1 or 6 months after his first teeth are showing in the mouth. The most important part is try to get your kid to get used to the dentist before there is anything wrong, so that we have time to play, to experience the office, to meet the dentist himself or herself. Before his first visit, there are a bunch of things you can do to prepare him. One thing I can't stress enough: don't use words like there is nothing scary, nothing is going to hurt you. Just don't mention anything like that. By doing so, which is in our mind, in a kid's best interest, we are explaining him not to worry about anything, don't be scared, don't be frightened, you won't feel any pain. All those things are bad in the kid's mind. He's already associating a visit to the dentist with some pain, with something hurting him. Just don't do it. Just don't mention anything like that. So how do we prepare? There are a bunch of dental games that you can buy, that you can find online. Play with him a bit. Count his teeth. Try to show him how the dentist will look into his mouth. Teach him how to show you his or her teeth. Something fun I saw is that you can keep a journal for example, a week, where you will write down all the times that he brushed his teeth, for how long, etc. And you can tell him that the dentist will check his homework. So the dentist will check him and give him a good grade, 5 stars or something. Now, when you actually take him to the dentist, we usually have something in the office to give to a kid after his successful first examination. However, this is something that the patient of mine did for her kid, and I thought it was a great idea. She brought me a gift for him before the appointment. So in the office, we usually have something to give, like a toothbrush or toothpaste or candy or some small toy. However, you as a parent know something that your kid wants. You know something that will make him happy. So if you buy a toy like that and bring it to us, give it to us before appointment so the kid doesn't see it, give that to him after the examination, that is actually a great gift for him. So I would strongly suggest following her footsteps. I thought it was amazing. Also, if you're going to a general dentist, your own dentist, you're solving the problem that he might not be so used to playing with kids, meeting them and giving them a gift afterwards, so he might not have a gift at the exact moment when he comes. So you scheduled an appointment, you came to the office, the door is opening. It's important immediately. Everybody needs to have smiles on their faces. The dentist, the staff working there, the parents, everybody is so excited that you're there, that the kid is there. We meet the kid. I usually try to immediately ask him about the toy he is holding, or compliment him on his jacket or on his shoes or on something that just appears that something he picked, not his parents. We slowly get to know each other, and as time goes on, we move into the actual dental office. Everything has to go slowly at first. You don't ask him to sit in the chair immediately. You show him everything around, whatever he seems to be interested with. Also, as a general advice, I recommend a parent that is not scared of the dentist or less scared to take the kid for his first visits. For the first visit, Our goal is only to look at his teeth, to count them, to write them down, to maybe brush them a bit, maybe use a toothpaste with our rotating brush in the office. We don't want to do anything. We just want to play with him, show him everything we got. Kids are in general very excited in the dental office. Smart and curious kids especially are my favorite to work with. They will let you do anything to them as long as you're explaining and showing them everything. We use cute names for all things around them. So for example, a filling on their tooth. It's not a filling, it's a star. Or I remember when I was a kid, my dentist would ask me what do I want for him to draw on my tooth. Of course I asked for a green dragon. He wasn't able to do it, of course, but that I know that now. At the time, I thought I had a green dragon drawn on my tooth. My mother was very excited when I showed her. I was actually much older, way too old when I realized that they lied to me. But in general, we tell them that we're drawing a star on their tooth. Disposable cotton rolls, for example. I call them, they might sound a bit strange in English, I realize that, but I call them, for example, a cushion, for a pillow for their tooth. That's where their tooth sleeps when I put the pillow next to it. The suction straw that we put in your mouth to suck all the saliva up. That's what we call a vacuum. It's important to just give names to things that they understand, that they can associate with the things that they have already been introduced to. The anesthetic, when the time comes that they need one, we don't call it a needle or an injection. We just call it a bee. That especially sounds strange in English. Okay, so you are familiar with the lingo now. However, when the kid sits in the chair, we will just start by showing him everything we have on the chair. We put for example, I can put the drill to the lowest setting, and when it turns, we can show him on his finger how it's just a little bit ticklish. We can let him play with the chair. We first show him the buttons, and then he can drive the chair up and down, back and front. We show him the water cup. We fill the water cup. Then he can fill the water cup himself. He can spill all the water out. He can use the vacuum cleaner to suck all the water from his cup. That's actually something that is extremely interesting to kids, and some kids will literally forever play with sucking up the water with a vacuum, and we have to take it away at some point. Something else we show him is the light. So the light is kind of painful to look at, so we can tell him that's the sun, and if we put on sunglasses, it's much more comfortable. If he likes sunglasses, he can wear them during the exam. Then we ask him to look at his teeth. So we just take the mirror, we show him the mirror, we show him the other instrument we are going to use to just count the teeth, for example, and then we pretend that we are counting his teeth. Everything is going slowly so that he is comfortable with it. If everything is going great, then the last thing we can do and consider everything was perfect and successful is clean his teeth. So we just use a rotating toothbrush that we have on our chair. We put some toothpaste, we ask him what flavor he would like, and then we use strawberry or cherry or lemon or mint or whatever he might like, and we very slowly clean his teeth, kinda. Of course, it doesn't do much, but it's just a way for him to get more relaxed with us. Long ago at the university, I remember studying about all kind of psychology profiles of different types of kids. And even to this day, the smart and curious ones are the easiest and most fun to work with. Even when you actually have to do something, they're fine with doing anything as long as you show them everything that you will do. So if you're gonna put something blue on their tooth, you show them first on your finger or on your hand. If you're gonna scratch the tooth with something, you show them first on their hand. Then you increase the drill. The meeting went hopefully successfully. What do you do after that? Well, the first thing is to schedule another one. just to make sure everything was fine. Next time he comes, you can do all the same things. Maybe we can do something else that he didn't get to experience the first time. Maybe we can show him how we take the impressions. We can mix the material for him, make a small ball. If we use a silicone, which is the more expensive material, we can even make a bouncy ball that he can play with. So at the end of the appointment, he will get his reward. Best to do it at the end, because if you give him something interesting during or at the start of the appointment, he or she is not paying attention to us at all. The kid is just trying to get his hand on the toy and play with it immediately. After the appointment, when he gets home, ask him what did he see, how fun was it, did he like the dentist, etc. Just get him talking about it so that he remembers and associates us with something good. As a bonus, maybe you can take him after the dentist to get ice cream or McDonald's, so again that he associates going to the dentist with something positive. Hopefully all his teeth are perfectly healthy. We don't have to do anything. However, remember to keep going to appointments, for example, once a year until there is a need for it. Other than all these playthings, we will actually want to, either on the first appointment or some of the next ones, we will want to slowly introduce some talk about oral hygiene, explaining how to brush his teeth, asking him how he does it, showing him, maybe correcting him a bit, introducing a new technique that he can use, asking him about some maybe bad habits like sucking his fingers. If he's really young, still using a pacifier, which you should stop using by the age of 2.5. Drinking orange juice right before sleep, breathing through his mouth, eating sweets. Explain to him why brushing his teeth is important. Motivate him to keep going. This was Dr. Vladan Stojanovic, your everyday dentist, and I will see you in the next video.